Hello, hello. All right. Let's see. Is this visible? I think so. Maybe hit the lights and get a little better lighting. Okay, perfect. All right. Today we are going to talk about all about foot changes during pregnancy. All right. So, in case you didn't know, a lot of people, a lot of women experience foot changes during their pregnancy, meaning that their feet get bigger. And even postpartum and for the rest of their life, they are in a new shoe size. Now, this might be news to you. And I know when I've told friends that who are newly pregnant, who haven't had babies before, they're like, really? That could actually happen? And yes, it actually happens. Your feet can change sizes during pregnancy. So let's talk about why, and then let's talk about what you can do to avoid that. Because really, who wants to have to buy a new shoe wardrobe afterwards? But even more so, who wants to like be set up with foot pain or all the other things that can come along with your feet changing sizes. And a lot of times we don't see the effects of that until postpartum. So we're going to talk about all about the feet during pregnancy. So it might be news to you that feet change size during pregnancy. And if that's the case, I am glad you're hearing it. And hopefully you're hearing it early in your pregnancy or maybe even midway through, because there's a lot we can do to help get your feet supported so you can avoid that stretch of the feet. So, number one, let's talk about the feet, or let's talk about what happens during pregnancy. When you're pregnant, even starting at 6 weeks, as early as 6 weeks, you'll have relaxin released in your body and progesterone. Those are going to increase the laxity of your ligaments and joints. Essentially, they're helping the pelvis become looser so it can stretch and open. Okay. But they're not that those hormones aren't just specific to the the pelvic joints. They also those hormones are going to affect the feet as well. And you may have heard in some of the other episodes that even once you're postpartum, from till when you're done breastfeeding, you can still have that joint instability and that joint flexibility. And that can even last 18 months post breastfeeding. So if you breastfeed for 2 years, tack on an additional 18 months. If you breastfeed 5 years, tack on an extra 18 months to that. And your joints are going to be more unstable and less supported during those periods just because of that hormonal change. Okay. So, what does this mean for your feet? Well, it means that your feet are more flexible. So, the joints move more. Okay. And what happens is we also gain weight, which you should during your pregnancy. And when you gain weight on flexible joints, it's going to cause them to spread out more. So, if this is my foot, and my joints are normally like locked and solid. When they become more flexible and loose, then you put more weight on them, they're going to stretch even more. So the foot can become wider and the foot can become longer. Okay. So this is very common. And if you had maybe you even like remember your mom saying like, oh, my feet have always been different since my pregnancy. That's just something I've always heard my mom say too. And you're like, yeah, mom, you told me that 100 times. Thanks for reminding me. But that's just something that can happen. Okay, so if that is happening, or when you initially get pregnant, there's a couple things you can do to prevent that from happening. Is number one, you can invest in custom fit orthotics. Number two, you can really hit the ground running on some heavy duty foot strengthening. Oftentimes, the strengthening isn't going to be enough to combat the weight and the laxity in the foot. So really you should do both. You should have a custom orthotic and you should have some good foot strengthening. But in pregnancy, we have so much other stuff going on that no one's like, oh, I'm just going to strengthen my foot here to keep it the same size. Now a lot of exercises do hit the feet if you're doing. I love bar 3 for foot strengthening. There's they do some great stuff there. But really, uh, supporting the foot with a custom orthotic is going to help. So, let's talk about what that custom orthotic can look like. Should we do that next? Yes, let's do that next. Okay. So, a great custom orthotic, and we have these here at Body Motion Physical Therapy, is going to have is going to support the arch in 3 different places. Okay. So here's the standard orthotic. I wore these every single day during my last pregnancy. And oh man, it's not like that clear. But if you can see, there's 3 arches here. So you have your medial arch. This is what most orthotics just have a support through here. So it's a medial arch support, but you also have a lateral arch of the foot. So that's on this side. Hopefully you can kind of see that. And then you have a transverse arch, which goes underneath the metatarsals. Okay. And so maybe you can see it in the blue better. But there's 3 arches here. There's such a glare for me. I don't know if there is for you, but you want all 3 of your arches supported. That is really super duper important in maintaining that foot size, maintaining that foot support, and it's going to help protect those joints. Now, the beautiful thing is, so you can use these for training. I trained in these. My last half marathon, I was wearing these. But for everyday use, I wear this guy. And they just can go in any shoe that you're wearing, which is fabulous. They also have flip-flops. So obviously during pregnancy, like who wants to bend over and tie your shoe, especially in the last trimester? So the flip-flop option is like super perfect for that. And I just love these flip-flops. And honestly, I need a new pair. Mine are pretty worn out. So this is what they look like. You can see the 3 arch supports there, the transverse arch support, the lateral arch support, and the medial arch support. And then it's like a black version. There's many different versions. They're super cute. I'm trying to show you those arches if you can see those there. But anyways, so regardless, you want to have support in 3 of the arches so you maintain your foot integrity, maintain the size of your foot. So that's like, aesthetically speaking. Obviously, we don't want to have to buy new shoes postpartum, but really what happens is because of that laxity postpartum, when you get back to training, or whether that's running for you, whether that is hiking, whether that's going to CrossFit, whatever it is for you, and you start to do heavy duty exercises, your feet are going to take a toll, and you're going to take a toll on weaker feet. And so we want, when that foot hits the ground, not only do we want that foot to be part of the shock absorption, but we want the core to start absorbing those forces for us. And that's why it's really important to restore your core postpartum. But the foot is really important in how those forces are transferred up to the pelvis and the hip. And so it's really important that you have good support. What we end up seeing so common postpartum, and I see this in probably, it's in so many postpartum patients. It's so common. I wonder if I wrote about this in my book. I can't recall. But we see pain on the outside of the foot, and we see pain at the top of the foot where you would get an ankle sprain. And so I'm actually just going to like bust out my foot and show you where we see this. So you can kind of, if you have this, or you will experience, you'll know what I'm talking about. So we often see pain on the outside of the foot here, on the top of the ankle, or the outside of the foot here. Testing my hamstring flexibility to show you that. But those are the 2 areas that we see really common. Obviously, we're a pelvic floor clinic, but we treat the whole body. And this is a really important piece of the puzzle when we're looking at the pelvis and symmetry of the pelvis. So what does that mean? That means that wearing an orthotic during pregnancy can help maintain the foot integrity and structure of the foot, so that when you recover postpartum, you won't have to deal with these little niggly aches and pains and, pain at the bottom of the foot and all that good stuff. So that's really good news. I'll just tell you my personal experience. So I'm a physical therapist, and my first 2 pregnancies, all of my pregnancies, I was on my feet a ton all day long, every day. And so my first 2 pregnancies, I actually did have orthotics because I was on my feet so much, but they didn't have the 3-way arch support. So they were just like, they were super feet. I was wearing super feet. They were on, that's what I had always run in. So I just continued wearing them during my pregnancy to help support my body. So at least I had that. But my feet during my first 2 pregnancies went from an 8 to a 9.5, which I'm currently a 9.5. And so my last pregnancy, I wore these orthotics. every single day. You would not find me without them because the minute I didn't have them, I could feel it in the outside of my foot. Um, but what is the most interesting thing is that this past pregnancy, thank goodness my feet didn't change size because I didn't want to increase from a 9.5, because I already feel like going from an 8 to a 9.5 was a substantial change, but very real. Um, and so, having this orthotic really helped maintain the structure of my current foot. All right. So then postpartum, it's been so fascinating. So as I sit here, I'm about 7.5 months postpartum, and I'm back to some pretty intense exercise. And typically, this is the exact point that I would get pain in the outside of my foot and in the top of my ankle. And so it's pain along, it's called your long dorsal ligament of the ankle, and then kind of along it's called the base of the fifth metatarsal. Um, and those areas are the points that I would always get pain and discomfort. And it's because of my old patterns of constantly, bearing more weight on the right leg versus the left leg. So that's an asymmetry. So the orthotics help to prevent that asymmetry along with working on the pelvis itself. So these are just important things for you to think about. and yeah, just thought that I would let you guys know that. And if you are pregnant, get yourself a custom fit orthotic to help maintain that foot integrity. And then also really important to help your recovery postpartum. So you have something that your body can like continually rely on as you move into retraining your core and all that good stuff. So I hope that was helpful, and we'll see you guys again tomorrow. Bye.